Your child has been diagnosed with a food allergy that could be severe, and you received a prescription for self-injectable epinephrine. The purpose of this program is to introduce you to two important topics about managing your child's food allergies. We'll discuss avoiding food allergens, which is the main treatment for food allergies. Even when families are avoiding the allergens, there's always the risk of an accident. So to be prepared, we will also discuss how to recognize and treat anaphylaxis, a severe allergic reaction. These materials were developed through the Consortium of Food Allergy Research, which is supported by the National Institutes of Allergy and Infectious Diseases of the National Institutes of Health. Let's start with, what is a food allergy? A food allergy happens when the body's immune system mistakenly attacks a food. This is different from a food intolerance. A food allergy could be severe or life-threatening, while an intolerance, for example lactose or milk sugar intolerance, usually leads to mild symptoms like diarrhea, stomach pain, and gas. Symptoms of an allergic reaction can be mild to severe. The milder symptoms that could happen include red itchy skin rashes such as hives that look like mosquito bites, swelling of the lips and face, itchiness of the mouth, sneezing, redness of the eyes, and gut symptoms such as pain and vomiting or diarrhea. These milder symptoms are usually treated with antihistamines such as Benadryl. Anaphylaxis is a serious allergic reaction. It comes on quickly and could be fatal. Symptoms usually happen within minutes after eating the wrong food. Only rarely will symptoms start more than 1 or 2 hours after eating the food. The most dangerous symptoms are breathing difficulties and poor blood circulation. Breathing difficulties could include tightness in the throat, repetitive coughing, wheezing and trouble breathing, trouble talking or drooling. Poor blood circulation may cause a child to look paler or faint. The child could become confused and lose consciousness. Sometimes in a severe reaction, people feel anxious or have a feeling of impending doom. The primary treatment of a severe allergic reaction is the injection of a medication called epinephrine or adrenaline. This medication reverses the severe symptoms, giving you time to call 911 and get to an emergency room. The most common prescription of epinephrine is a self-injectable. Self-injectable epinephrine is a spring-loaded device, and it gives the medication automatically. Additional medications that may be given for an allergic reaction are antihistamines like Benadryl or asthma rescue inhalers for children who have asthma. They're typically part of the treatment of an allergic reaction. However, antihistamines and asthma inhalers do not reverse the severe symptoms of anaphylaxis. An antihistamine is given to reduce swelling and itch. For children with asthma, asthma rescue inhalers may also help some of the breathing difficulties that can happen during anaphylaxis, but it's important to remember that epinephrine is the main treatment for anaphylaxis. It's crucial to give the epinephrine to reverse the severe symptoms. Using only the asthma rescue inhaler or antihistamine is dangerous. Even when severe symptoms are treated properly with epinephrine, they could return. So, if your child has an anaphylactic reaction, you should always go to the emergency room for observation. You should stay in the emergency room for several hours to be sure your child's okay. Sometimes additional epinephrine or other treatments are needed. Epinephrine should be given if there are breathing or circulation symptoms, or if a reaction is getting worse. Talk to your doctor, specifically what may be best for your child. Certainly, if your child ingested the wrong food and had symptoms that affected breathing or blood circulation, you should inject epinephrine. If you're not sure whether symptoms are severe or getting worse, especially if it's clear your child ate the wrong food, go ahead and give the shot of epinephrine anyway. In other words, when in doubt, inject. The medication's safe. The main side effect is having the heartbeat faster, but it'll come back to normal without causing any harm. You'll need to work with your doctor to create an emergency treatment plan. The sooner a reaction is treated, the less severe the symptoms are likely to become. It's possible to have anaphylaxis even when you don't see hives if there are other symptoms. There are several brands of self-injectors available. Your doctor will show you how yours works. Always check the expiration date on your self-injector. The self-injector should be kept around room temperature and not refrigerated or in extremes of heat. For example, a glove compartment is not a good place to store a self-injector because it could get too hot or too cold, and that could damage the medication. The injections can go through clothing, but if time permits, you may want to remove clothing. Remember to always have your injector available. Many doctors prescribe 2 doses in case a second is needed if symptoms get worse or fail to improve after a first dose if you've not yet gotten to an emergency room. Once your doctor has diagnosed which foods you must avoid, it's important to learn several basic skills on how to avoid them. One important skill is label reading. Currently, the labeling laws require that if there are ingredients of milk, soy, wheat, egg, peanut, tree nuts, fish, and crustacean shellfish, they must be on the label using plain English words. Tree nuts include nuts such as almond, pecan, pistachio, walnut, cashew, and others. Crustacean shellfish includes shrimp, lobster, and crab, but does not include mollusks such as clams, mussels, or scallops. You have to read the entire label because usually the words are within the ingredient list, or sometimes there's a separate area saying or listing specific allergens. For example, the allergy warning contains peanut. Manufacturers must choose plain English words such as milk instead of scientific words like casein to indicate these major allergens. Remember, not all allergens are covered by the law, only the 8 major allergens. So if your child's allergic to clams, which are mollusks and not crustacean shellfish, or if they're allergic to a food like sesame seeds or garlic or virtually any food other than the major ones, well, these other foods could be hidden and included under words with vague terms such as natural flavoring or spices. It's also important to understand what we call advisory labeling. For example, words like may contain or made in a facility that also processes. These statements currently are used voluntarily by companies. Advisory labels are not regulated, so we suggest avoiding foods with advisory labels because there's a risk of cross-contact. Labeling laws do not cover medications or cosmetics that could have an allergen as an ingredient, so be careful about these as well. You should understand the dangers of cross-contact. Cross-contact happens when an unsafe food allergen accidentally comes in contact with an allergen-safe food and contaminates it so it's not safe any longer. For example, if I used a knife to spread peanut butter and then dip that knife into a jelly jar, then the jelly is contaminated with peanut. This is cross-contact. Unwashed utensils used with allergens have to be kept away from your child's food. Let me give you a few examples. If you go to an ice cream shop and they scoop ice cream from various flavors with the same scooper, they may have cross-contacted. For example, peanut into the vanilla barrel even before you got to the store. Asking for a clean scooper may not help because the barrel of plain vanilla already has some peanut in it from a prior cross-contact. In a restaurant, shared grills or food processors could also cause cross-contact. It would not be safe to have food made in a wok or a pan or on a griddle where other food allergens had been used before. Deep fryers do not destroy allergens, so cross-contact could also occur in fryers. A buffet is a risky eatery for someone with food allergies because spilling or people serving food from one tray to a next, the same shared utensils, this all may result in cross-contact. Washing hands and dishes and utensils and cooking equipment with soap and running water is typically all that's needed to remove allergens. Antibacterial gels do not remove the allergens from you or your child's hands. Talk to your doctor about eating in restaurants and travel. It's very important to discuss your child's allergy with the restaurant personnel, especially the individual who makes the food. Written materials may be helpful, like this card telling about your child's food allergies. Confirm with the restaurant that this is an allergy and not just a distaste of the food, and that your child could become very sick if a mistake happened. Teach them a bit about cross-contact, for example, about shared slicers or shared cutting boards and fryers. You should also discuss possible hidden ingredients, such as peanut flour used in a pasta sauce. If you're not sure if that food is safe, don't let your child eat it. Additional information about all of these topics and many others is available in your informational pack. Look up the checklist for managing food allergies and the one-page summary in the packet. Having a diagnosis of food allergy is a life-changing experience, and there's also information in the packet with suggestions about maintaining a healthy lifestyle with food allergies. Your child should be able to do everything that the other children do, except eat the food to which they're allergic. They should be able to stay safe and happy. Please use these materials in concert with your doctor's advice to achieve these important goals.